Good morning. Some married couples really want to have children, but after trying for years, they are still not blessed with a child. Everyone has the right to have a child, but what if you are infertile? Infertility is a global reproductive health issue that affects many individuals and couples. However, some married couples with no problem getting children, but they want to plan for their desired number of children, timing, and intervals between the birth of the children. This is where contraception comes in for family planning and prevent unwanted pregnancy. Approximately 80 to 85% of couples who are trying to become pregnant will successfully conceive within a year. Infertility or sterility is commonly defined as the inability to achieve pregnancy within 12 months of unprotected intercourse. When the married couple has tried to conceive for more than a year, but they are still not successful, the couple is advised to seek for medical consultation. When a married couple is unable to bear children, the husband or wife or both may be sterile. So next, let's look at the factors of sterility in males and females. Now, factors of sterility in males: hormone imbalance, defective reproductive organ or organs infected with disease, health problem like diabetes. Besides, testes cannot produce sperms also could be one reason of sterility. Low sperm count. Low sperm count means the sperm count is considered lower than normal if you have fewer than 15 million sperms per milliliter of semen. Produces low sperm qualities. And impotent. What is impotent? Impotent is the inability for a man to get and maintain an erection. Now, factors of sterility in females: hormone imbalance, defective reproductive organs or organs infected with disease, health problem. Besides, ovaries cannot produce ovum, blockage in the fallopian tube here, and then abnormal uterus, and also tumor in uterus. With advancements in science and technology, there are many methods to help married couples who are unable to have children to solve their infertility problems. Okay, first method is hormone treatment. Second method is surgery. And the third method is in vitro method. Hormone treatment. Individuals with hormone imbalance and inability to produce strong and healthy gametes can be treated with hormones. This stimulates the testes and ovaries to produce over and more sperms. The second method is surgery. Blockages or growth inside the fallopian tube, or men who have blockage in their sperm duct can be removed by surgery using laparoscope. This is a laparoscope. The third method is in vitro fertilization, or we call it IVF. This procedure is done on women who have blockage in their fallopian tube. Test tube baby refers to children conceived with IVF. So, first step, the woman is given hormone treatment to stimulate egg production. Then, multiple eggs means more than one egg. Multiple eggs are taken from the woman's ovary. Then, in the lab, the eggs are mixed with the man's sperm cells in a culture dish to become fertilized. In another word, the fertilization occurs outside the body of the female. Then, the fertilized egg or embryos are placed in an incubator for about 48 hours. Then, embryos are implanted in the women's uterus. So, the development of the embryo will continue to become a fetus, and finally, a test tube baby is produced. You have learned about methods to overcome infertility. Next, let's learn about methods of contraception. What is contraception? Contraception or birth control refers to the ways to prevent pregnancy by preventing fertilization, ovulation, or implantation of the embryo. Various methods of contraception allow married couples to plan their desired number of children and determine the intervals between the birth of the children. Now, the method of contraception can be divided into two groups: the temporary contraception and permanent contraception. Temporary contraception is reversible. That means this year, if you don't want to have children, you can choose to use the temporary contraception method. But next year, if you want children, you can have it. Whereas permanent contraception, once you make up your mind and the procedure is done, it is irreversible. That means you cannot get pregnant for your whole life. The temporary contraception can be divided to either preventing ovulation, preventing fertilization, or preventing implantation of fertilized ovum. Contraceptive pills, implants, use of condom, intrauterine contraceptive device, these four are temporary contraceptive methods. Whereas vasectomy and ligation, these two are permanent contraceptive methods. So, for contraceptive pill, it is the pill containing combination of female hormones, and it is to prevent ovulation. Implants. Implant is a tube that is inserted in the skin below the arm. Okay, so implant secretes hormone that prevents the ovary from producing ovum. So it is to prevent ovulation too. The use of condom. Condom is worn over a penis before copulation to prevent the sperm from entering the vagina during ejaculation. So condom is to prevent fertilization. Then the use of intrauterine contraceptive device, or we call it IUCD. This contraceptive device is inserted inside the woman's uterus to prevent implantation. Okay, vasectomy. Vasectomy is a surgery that carried out to cut the sperm duct, and the two ends are then tied to prevent the sperms from being transported to the urethra. So this is to prevent fertilization. And then ligation for women. Okay, surgery is carried out to cut the fallopian tube, and the two ends are then tied to prevent the ovum from meeting the sperms. So this is also to prevent fertilization. Next, let's look at the importance of practicing frequent health screening to get immediate treatment for problems related to reproductive system. An individual is encouraged to do at least one health screening per year starting at the age of 40. Why is health screening or medical checkup so important? Health screening is done as an evaluation to detect early symptoms of chronic diseases. Cancer involving reproductive system such as uterine cancer, cervical cancer, and prostate cancer can still be treated if it is detected earlier. Practicing health screening can reduce the risk of health problems which require high-cost treatments. The correct and safe contraceptive method can be understood by consulting doctors during the health screening. The abuse of knowledge about contraception has encouraged social problems such as premarital sex, that means sex before marriage, and immoral behavior especially among teenagers. Besides, prolonged use of contraceptive pills may affect the menstrual cycle and may cause infertility. So, contraception is to solve problems and not to create more problems. That's all for today's lesson. Thank you.